Good afternoon, everyone. Thank you for joining us. For those of you who don't know me, I'm Shane Dorrell with the Division of Strategic Communications at the University of Alabama. Before I introduce our guests and we jump into the question and answer portion, just a few housekeeping items. I know most of you know how these things run now that we've been in this pandemic for several months. But the webinar is being recorded, and we will be able to provide a link to the video later today for those of you who need it. Just let me know. At the bottom of your screen, you should see a chat feature. I think most of you have found it already. Please use the chat feature to ask your questions. Please give your name and the media outlet at the beginning of your question. I will ask the questions, and I'll try to make sure that everyone gets to ask their first question before I move to a second round of questions, just to make it fair. Our guest today is Dr. Richard Friend. He's the Dean of the University of Alabama College of Community Health Sciences and Professor of Family, Internal, and Rural Medicine. Dr. Friend has extensive administrative and clinical expertise. Dr. Friend is also a member of the UA President's Advisory Committee, which serves as a sounding board for the discussion of COVID-19's impact on the campus community to UA President Dr. Stuart Bell. Dr. Friend and the other committee members help UA leaders understand the unique situational perspectives of the diverse student and employee bodies and aid in developing the best adjustments needed to accommodate their needs. The committee is also a platform for those representatives to have discussions with UA's team of medical professionals, administrators, and other experts. So good afternoon, Dr. Friend. Do you have anything you'd like to share before we begin the questions?
Sure. Well, thank you, everybody, for being here today. It's a real honor to be before you. Thank you, Shane, for the introduction. As you've heard, my name is Dr. Ricky Friend. I'm the Dean of the College of Community Health Sciences here at the University of Alabama. As many of you know, we've been engaged since day one in testing of students, faculty, and staff across campus. We know of no other university or university system with a more comprehensive testing plan, or one that has devoted more resources to testing since our students arrived on campus. I'm very appreciative to Chancellor St. John, President Bell, and everyone who has given us unwavering support and resources for our testing efforts and other aspects of the health and safety plan. Before our students came to campus, they were tested and required to provide results of a negative test. We appreciate the UA system's role in making this happen, as well as Governor Ivey, who designated $30 million in CARES Act funding to all college students in Alabama who were tested at no cost. When campuses responded, we moved quickly to roll out the next phase of our plan, which includes additional testing and follow-up, as well as isolation and quarantine plans. We have tested thousands of students over the past 2 weeks. Although I'm not able to share specific testing data with you this afternoon, it's my understanding the UA system plan is to update the online testing dashboard Friday with the latest numbers from UA, UAB, and UA Huntsville. For the past 2 weeks, our focus has been utilizing our rapid testing capabilities to identify and test students who may live with other students who have tested positive. We are testing students who are symptomatic and those who have been identified as close contacts of positive cases, both on and off campus. Next week, we will begin sentinel testing, which includes weekly testing of 2.5% to 4% of the student, faculty, and staff populations. As we fully expected, our comprehensive testing program identified a significant number of positives. Fortunately, we have no evidence that any viral transmission occurred in the classroom. We have no reports of students being hospitalized. I also want to reiterate that our classrooms, labs, and other faculty and student areas have been modified to assure social distancing, mandatory face coverings, and small groups. These are among the safest in our community as a result of our planning, preparation, and enforcement measures. In addition to our testing protocols, we are devoting significant resources to our quarantine and isolation spaces. As of this morning, the isolation space is at less than 50% occupancy, which we monitor daily. We have instituted a number of resources for those in quarantine, including around-the-clock security, a medical liaison on call 24/7, and direct access to our mental health professionals. The university is working very hard to provide comfortable living arrangements for on-campus students, as well as those who need a place to stay while in isolation or quarantine. We have fine-tuned our process over these last weeks as we work diligently to accommodate individual students and their needs. Testing, exposure, notification, isolation, and quarantine are absolutely the best medical strategies to mitigate the spread and keep our campus safe. Currently, we have 34 employees whose work is dedicated to contact tracing. Based on the fact that we have no evidence of classroom transmission, we have confidence that our health and safety protocols are working and we can safely continue on-campus instruction. We are in daily communication with DCH Hospital System and closely monitor their COVID patient trends. Right now, the hospital's in really good shape from a capacity standpoint. The additional measures enacted by the campus and the city last week to limit student activities and close the bars are critical, but these will take time to really make an impact. It will take time to see the full impact, and the next couple of weeks will tell us more about how those measures are helping to help bend the curve. Let me be very clear. We have great concern about social gatherings off campus, and I know the university has ramped up compliance efforts to help keep the campus community safe. I can't stress enough the importance of wearing a mask, avoiding large gatherings, and maintaining social distancing anytime you are around other people. We have taken many important steps this week, and I believe we have a real opportunity to reverse these trends. But it will take the full commitment of our students, as I know they want to remain on campus, and that is a goal I believe we all share. Thank you, Shane.
Dr. Friend, our first question comes from Stephen Deathridge of Town Square Media here in Tuscaloosa, and he asked this: Dr. Friend, much has been made about moving at the speed of the virus. Both the ADPH and the DCH health systems release updated COVID case numbers at least once a day, usually twice a day. Can you talk about why the UA system is only releasing numbers once a week on each Friday afternoon?
You know, I'm only aware that the UA system is updating the dashboard. That's a UA system decision, and I support that decision. So I would have to defer that question to somebody in the systems office.
Our next question comes from Brian Pia of ABC 3340. At the University of Alabama, there are 1,201 positive COVID cases, more than any other UA system schools. Percentage of positive cases is 1.04%, more than others in the system, and 36.09% occupancy of isolation space at the University of Alabama. Brian wants to know what's gone wrong and what are you doing to prevent further outbreaks?
I would say nothing's gone wrong, Brian, and thank you for the question. We have the largest campus in the state. We have approximately 40,000 students, 6,000 faculty and staff. We anticipated the quarantine and isolation space we needed, I think with great foresight, early in June. We also, early in June, anticipated the great need for rapid, accurate testing on a consistent basis. And we are able to operate safely with those tools. We're constantly refining our plans. And I think, as you said, the virus is really dictating where we are and how we move next.
Our next question is from Kelvin Reynolds of Fox 6. And Kelvin asked, what changes has UA implemented on campus to reduce COVID spread?
Well, I think would be best to refer to Dr. Myron Pope's last communication and Dr. Bell's emails. I know there's a number of risk mitigation strategies going on through student life and across campus. And I think those have been well publicized. I'm very proud of the students. They're working very hard to change behavior and to adjust to these challenging times. And they really are doing a great job.
Our next question is from Michael Casagrande of AL.com. And Michael asked this: were you expecting this many positive tests among students, or were you surprised by what happened when classes resumed?
Again, that's a great question, Michael. I think, you know, this is the once in a 100-year pandemic. It's the first time in my medical career that we've been faced with this. And I really get up every day and think about what's going to happen next. I can't predict it. I just am doing my very best to do good work for the campus and the UA system and the chancellor to make sure that we can keep campus safe. And I think every day is a new day, and we're working very hard to do that.
Our next question comes from Mark Cobb of the Tuscaloosa News. And Mark asked this: Dr. Friend, you mentioned the necessity of the city's bars closing and the move that the mayor made. Can you talk more about why the city's businesses, many of which don't cater to students, should face such measures?
You know, that's really not for me to decide. What I know to be true from global data and data across the country is that large gatherings, large crowds, close proximity, within 6 foot of distance, and not wearing face coverings will cause the virus to spread, and we know that. So that's the mayor and his decision. We meet with the mayor's team regularly and provide him with daily medical advice, and that's really up to him.
Well, the next question really speaks or asks about the data, and it's from Stephen Deathridge, again, of the Tuscaloosa Thread and Town Square Media. And Stephen asked this: Mayor Walt Maddox said part of his decision to close the bars came from studies that have been done, and this is information provided by UAB's epidemiologist, which showed bars were more conducive for spreading COVID-19 than big box stores, restaurants, etc. What does that data look like, and what does it demonstrate?
So again, I'll go back to my last answer, which is that we know for certain that large gatherings where social distancing and appropriate face coverings cannot be maintained, the virus will spread quickly. And we really need to be careful as a community to make sure we're all doing our part. The students and the university campus is part of that community, but we're also very sensitive to our community partners, and that's really what we want to do to stop the spread within the community.
Ryan Phillips of the Tuscaloosa Patch asked this question: have other on-campus locations, other than those currently being used, been identified for expanded isolation space?
That would be a good question for Myron Pope and his team. I'm not involved in obtaining the quarantine and isolation space, so I would ask that you would defer that question to Dr. Pope.
Great. And Ryan, I'll just ask you, I'll make a note of this, but I would ask you to just email me, and I'll see if I can get an answer for you to that question. Our next question is from Mike Royer of WBUA. Dr. Friend, please give us some guidance regarding the importance of getting a flu shot and when you would advise getting one, now, or should we wait until October?
You know, Mike, that is a great question. That is the next worst concern on my mind. And we're already planning for it. The university has purchased over 10,000 doses of flu vaccine. Those will be administered by College of Community Health Sciences across campus. What I'm seeing across the globe is that these are historic times, and that these are the lowest flu counts on record in Australia. And the social distancing and masking are no doubt playing a part in that. But as a clinician and as a hospital staff member, I certainly worry about the impact of flu and COVID together. by getting vaccination. Mid-September is the recommendation during flu season. Beginning mid-September is the best way we can really protect ourselves and protect our community and our resources going forward.
Our next question is from Jeff Eliasoff from NBC 13 or WBTM 13 out of Birmingham. If no students are in the hospital, how can you convince them of the gravity of the situation? And again, what's the latest number of positive cases on campus? And I'll just answer that. Jeff and everyone else, we want to refer you to the UA System dashboard that you will find at uasystem.edu. Those are our latest numbers, and you'll find those there. And again, those numbers will be updated weekly. They will be updated again this Friday. So again, uasystem.edu. You can find the dashboard once you get to that website. But again, the question, Dr. Friend, is how do we help students? How do we convince them of the gravity of this situation?
You know, I think the students play a critical role in all of this. From an epidemiologic standpoint, the 18 to 25-year-old group is not going to suffer much disease burden, but they will spread the virus. And it's incumbent upon every campus member, faculty, staff, students, to practice these guidelines wherever they go. I do believe that through education, training, reinforcement, and enforcement of the proper guidelines, that we are making progress on our campus. And I'm very proud of the students and the faculty and the administration for the work we're doing.
Our next question comes from Brian Pia of ABC 3340. And Brian asks, there are emails circulating where UA professors were explicitly instructed not to tell their students if someone in class tests positive. What's your response, and can you explain UA's policy?
So I haven't seen those emails. I know there has been some reporting about that, and I would just refer you back to that initial university response.
Michael from AL.com asks, have you seen any encouraging numbers that indicate that the curve is flattening?
What I've seen is tremendous effort on everybody's part to mitigate the initial positive cases that we were seeing on campus. I remain cautiously optimistic that we're headed in the right direction, but truly we're not going to see the results of all of our efforts until after Labor Day and possibly the week after that. And we know that historically, that's how this works.
Here's another question from Stephen Deathridge. And Stephen asks, Stephen says that he's heard a lot about reentry testing and that many of those tests were self-administered and not as reliable as the more invasive tests given to symptomatic cases. Can you talk about our reentry tests and their reliability? And are you confident the low case numbers we saw on reentry testing were as accurate as they could have been?
Yeah, I think that's a great question. The collection method that was used for the reentry testing was emergently approved by the FDA. It is a observed collection for those on campus, where you simply swab the anterior and middle portions of the nose. And we know with PCR testing, the very, very sensitive testing, that even very small amounts of the virus will be picked up. So I'm very confident in those numbers. For the students that got mail-in kits in the states that allowed that, there was an instruction kit. And those results also I'm very confident. So yes, I think the numbers are right on. They're consistent with our overall population and really show the low disease burden on reentry on all the campuses.
Our next question from Brian of ABC 3340, and he asks, at what point, what's the number that will trigger a decision to cancel classes?
Well, Brian, I think we've said, and I know Dr. Bell has said, we're not looking at one number. We're looking at a lot of different metrics Science is evolving every day, and we're working very hard to get as much information as we can to make good decisions. And I trust that we will use all of those metrics to make whatever decision is needed to keep campus safe.
Well, Dr. Friend, we are almost out of time, and I don't see any additional questions in the chat. Would you like to say something in closing?
No, I just want to thank everybody for being here. And I hope that I've put some of the university and systems response into context for you so that you have some information that can help you with your informed reporting. So thank you.
Thank you, Dr. Friend. And again, thank you to all of our media partners for joining us. I want to remind everyone that you can get the latest information on the UA System dashboard, which you can find at uasystem, all one word, .edu, uasystem.edu. You can also find all the information that we as the University of Alabama are putting out, and that includes messages to our students, messages to our faculty and staff, and all of our policies and directives. You can find all that information on healthinfo.ua.edu. Again, healthinfo, all one word, .ua.edu.